I'm told that our special guest speaker is now here. So let me say thanks to Dr. Marcel Tanner, who Ong will introduce and field questions after his presentation. Ong, over to you.
Thank you very much, Jimmy. Good morning, good afternoon, good evening, everyone. I go here so that Marcel can see me as well. Good morning, Marcel. Good morning to Basen. Can you hear me, Marcel?
Good morning to you, everybody. Habarini Samchana.
Yes, Marcel, I think that if you can regulate a bit the camera so that we can see you as a whole face, that would be nice.
Yes, because, yes, I don't see myself here, but I will see as soon as I start to. Yeah. Mm-hmm.
Okay, that is perfect. It's perfect. Okay. I'm very happy. I'm very happy, in fact, to introduce Marcel Tanner today. Actually, I hesitated very much to propose to Marcel this talk because I know that he's very busy with his role as an advisory board member of the COVID-19 task force of Switzerland. But when I talked with him a few weeks ago, he immediately agreed because he says that ILRI is a very good partner and he knows different people here. And with that, I would like to introduce to you Professor Marcel Tanner. I always call him Marcel because he was my former boss at Swiss TPH in Switzerland a few years back. Marcel is actually the current president of the Swiss Academies of Art and Sciences of Switzerland. But before that, he was long time the director of the Swiss Tropical and Public Health Institute. That is also a very long-standing partner of our ILRI as well. And it was very impressive to see that Marcel brought and grew an institute when he took over with only 80 people. And when he was stepping down, handling to our dear colleague, Jörg Usinger, the institute had about 750 people, with a similar budget that ILRI is having at the moment. And I talked with Jimmy the other day. So, and he brought really nicely a very large institute in Switzerland, but working globally on global health and so on. Marcel was also the professor in epidemiology at the University of Basel, one of the oldest universities in Europe. And he was acting as the Dean of Faculty of Science for many years. He's a specialist of global and public health. And with that, he is wearing, and he has been wearing many hats at chair of many initiatives to eradicate malaria. And I would just emphasize that, thanks to him, he was very much instrumental in setting up the malaria vaccine trials in 11 African countries, the so-called STSS trials, and giving a lot of positive result over there. But more importantly, maybe it's interesting for ILRI audience that is actually he helped together with partners in Africa to really establish two big health research institutions in Tanzania, in Fakara Institute, and the Centre Suisse de Recherche Scientifique in Côte d'Ivoire. He's also the member of advisory of many organizations like WHO Strategic Advisory Group, Wellcome Trust, Bill and Melinda Gates Foundation, Bodna Foundation, etc., etc. I just want to finish, and Marcel, you don't have to wait now more. That because we are from the research institute, and you always told me that the impact factor and paper are not very most important, but we train people and we have people. But for those who are interested in Marcel, a scientific profile, he has a quite respected age index of almost 66 by Web of Science, almost 30,000 citations and over 500 papers. And with that, I would like to invite you today, Marcel, to give a talk, and we agree that you will give some highlight about from science to policy and public health action experience from COVID-19 pandemics. And afterwards, we hope that we will have some time for discussion with you and our ILRI colleagues. And now for the information, you are talking with over 300 staff of ILRI at the moment. Over to you, Marcel.
Thank you very much. Thank you very much, Hung. Thank you very much, all dear distinguished honorable colleagues, professors and directors of ILRI, and just scientists of ILRI, and all the ones that make up the huge power that ILRI has. and it's a big pleasure to be here with you. I mean, if I would be in Tanzania, I would dare to give this talk in Swahili, but in Kenya, as we know, Swahili is already a little bit getting sick. Kwa hiyo siwezi kuongea na Kiswahili, lakini ninafurahi sana, ninashukuru sana kwa kupata nafasi kurudi tena nyumbani. Nyumbani, home is actually East Africa for me as well. So it's not only Switzerland, and it's a big pleasure to share with you some insight into these issues that we have now with SARS CoV2, COVID-19 pandemic. And it's maybe interesting for you to know that I'm also already since the beginning of the crisis, I'm linked with some of your Kenyan colleagues in around Lake Victoria in Siaya district and around, in order to really go at the periphery to look at this problem of SARS-2 transmission. So it's thank you very much again for this invitation. What I want to do with you, I want to share some of the issues that we have not only in Switzerland, but actually how we can, again, in the spirit that I have always followed, is this mutual learning for change, that we can learn together when we think about, in this case now, the pandemic, how we can learn together in order to make a difference in global public health. I have prepared a few slides and I hope you can see the screen. I can see it, that it is shared, but otherwise you just must shout if you don't see it, and you see me as well now. And I would like to start with some basics. I want to give you this possibility. The big question in all the countries and in the areas are always the question of which strategies and which approaches that you have to do if something unexpected happens, and how you go with all this. So I start with this picture on the strategies. These are some basic slides. You know, this is actually when everything was in full swing. Here we were driving through DRC in 2005. And then suddenly in full swing, something happens. In this case, it was this snake that went over the street. And we were actually, this is an easy case. When this happens to you, you just stop and you wait until nicely the snake is over, and then you are just admire the beautiful incident that you had the chance to see this python. Now, when it came to COVID, some people actually, and particularly scientists, they just looked at it in a strategy in a different way. They looked at the strategy in this way, that they will say, oh, we have a very big problem, and now just let's look, let's examine, let's do some research, let's find out. But with this attitude, as you can agree, I mean, the rock, the big rock still remains, and they will not move away. And you are just doing some very nice descriptions and some nice analysis. Another important thing for the strategies in such pandemic situation, but always actually, is this picture, is that you need to have the right tools. You know, this man here doesn't have the right tool to knock down the tree. So whenever we actually design strategies, sometimes very theoretically, we are actually challenged to have to also ask which are the right tools. So just keep these pictures. Then there is another strategies that many people have tried at the beginning of not only the SARS situation. They have actually done this, what this penguin man does. It's do one brave thing today and then run like hell. That's what they sometimes do. This, of course, as you can see, it looks nice, it's attractive, but it's not the strategy that carries us forward. And if you just do one thing that you think is fine, you may endanger here the mama penguin that actually, when the ice bear wakes up, has a serious problem. So what we are in now in the strategy discussion is actually this one, is actually that we do fun and have extreme sports. Fun means that we do our science with enthusiasm, not just happy life, enthusiasm, committed, and we are actually targeted to what we have to solve. We protect ourselves, but actually we are very much determined to reach that. So this is one of the basics that we always have to think, that we are not dropping into these strategy traps that are very often, if the strategies are not rooted to the realities. As I don't have to say in ILRI, but it is something which I had, and this is not to teach you, but actually I had actually a really big problem in some other context to actually show people that this whole issue of emerging and re-emerging diseases is actually very much linked to something which is dear to me. And what you do is really the One Health issue that we have here to deal with zoonotic diseases. And that means that we are actually not just can say it's why we have SARS, SARS-1, SARS-2, MERS, and then the thing is over. But the potential all over is large, and that we have to have a spirit of surveillance in order to really detect what is coming for us. And also this surveillance spirit is important in our strategies to fight the pandemic now. And I think this comes in particularly, as you know, there are from 1,400 pathogens, 800 around cross the animal-human barrier. But more important is what you know very well, is that we have always not just a neglected disease, an emerging disease. We always have, and that's particularly clear in many settings nowadays. It's the triangle, the tripod of neglected diseases, neglected people, but also neglected health and social systems. You see, when we are now wanting to have a strategy of control, then actually we very often see what we have to control, but we don't have the systems to carry that through. So these are basic slides that you mostly know, but I just wanted to remind you that, because this is important when people discuss strategy. And the most important one is this basic slide that some of you who know me and have seen it before, that is actually to understand if we come from an efficacious tool to an effective community action or a health systems action. And it is this famous cascade, downhill cascade, that we actually have here, an efficacy of a tool, let's say an efficacy of drug, which is 80%, but actually what counts that you reach effectiveness in a community is that you need to ensure access. The blue, the targeted, you need to know whom to target. You must have from the provider the compliance and from the consumer the adherence. These blue factors are health system factors, but they're also factors on how we collaborate together. So if you have also a very nice efficacy of 80%, if you do not reach here 100%, if you are actually low in these health system factors, your effectiveness in this example collapses to 29%. If we do not effectively work together, we collapse the effectiveness, and that's at the end what counts. And that's particularly important if you take interventions and tools like masks, if you take interventions like distancing, and if this is not 100% done, then you can imagine that the efficacy of a tool reduces then its effectiveness in a substantial way. So I think this is something which is very specific now, but is something to think about in all our health interventions, when we not only aim at the magic bullet, the drug or the vaccine, but we also think what it means to carry this magic bullet to the communities concerned. And of course, if you have not 100% effectiveness, you ask the question, do we reach everybody? And that's particularly important in a situation where you have a pandemic situation, that you are equitable. If you have 80% effectiveness, but the remaining 20% are actually the poorest people, the most neglected people, then you have not the high equity effectiveness. This is just now basics. And I say now, when does it come now to SARS-2 COVID-19? Then actually it's now the moment. But this is the fundamental thinking about the strategies that apply for all the countries. And I know very well, for instance, your Kenya, being in Kenya at the Lake Victoria area, this issue of just saying, we have masks, we have distancing and things are fine. If we don't have the compliance and adherence, we are actually losing the effects. And this was actually seen in the first wave in the Siaya area very clearly before it was reinforced. This is how it started for us, for all of us. This is an old graph when we actually got these dramatic pictures of doubling times every 2 days in some countries, Spain, Iran, Italy. We got the doubling times here in Central Europe, Canada, Australia. And then we had actually, that was the very beginning when we didn't have any data a lot on the African situation. I show you this is just out of this situation. Many of the countries were totally overwhelmed, and particularly it's also true for our country. And it's very interesting then when science come in, science only came in after we had the lockdown. So the scientific task force to inform the government about how we would move in this difficult situation actually came only in force in the 1st of April, that the government created a science task force to assist the Federal Council at the crisis team and the steering committee. But we had the lockdown already on the 16th of March. So until the political level realized, oh, basically we should also involve the scientists to inform us about the scientific basis, it took some time. And what we do as a scientific task force, and that's very important for many of the settings, we produce policy briefs and situation analysis, and these are all public. So on this website, and I will give you Hung or others this presentation, and you can be distributed. We are actually all what we produce as scientists, and that's a very important point, is not only for the government, but it is for the public and for the whole world. Everybody can read our website where actually these policy briefs are, basically in English, but also, of course, in our national languages. And what we do in addition as this task force, just to show you how we try to inform the government, is that we are actually have continuous input into calculating and projecting the effective reproduction rate, as well as the TTIQ, which reads as tick. It's the tick, that means it's testing, tracing, the isolation and quarantine, the system that is partly based also on an app. And this is actually the scientific contribution to constantly inform, not for the whole country, but actually for the regions, the reproduction rate, as well as the contact tracing situation. So it's these two elements that flow into the decision-making process. The measures are actually then decided in the socio-political discussion, not only by the scientists, but by the Federal Council, but with community representatives and with also the different private sector and all the peoples that are then involved in our economic and social tissue. So clearly it is not that we say what has to be done, but we inform about options of things that could, and we sometimes are a little bit stronger by saying should be done. But we are not, we are actually making policy relevant statements and options to act, but we do not do policy prescription. As soon as you go into the field, and that's internationally an important issue, you can see this always, if the science does not just makes policy relevant statements, but makes policy prescriptions, we run into problems of politics. And then the people say science is no longer independent, the scientists support are corrupt, or actually really only have their own self-interest. So as you can see from this very summary, we actually faced with science to inform policy. We actually are walking a tightrope between really these relevant statements, the scientific evidence, and the policy prescription. So this is, I'm sorry, this is in French, but I think the scientists also have a duty. And this is not only just that with epidemiology, but also with social science, with economics, that we are not just saying, oh, we can actually, we can kill corona by just having a heavy caterpillar with a large ball that breaks all the transmissions. But then what remains at the end is a heap of an economy that is collapsed, a social tissue that is collapsed. So this is actually not to discuss in detail, that looks wild, but this actually is what we produce in the science, is that for the country, but also for the different regions, we have this, the solid lila line is the reproduction rate, effective reproduction rate of transmission. And so we follow from the beginning over time, if the case reproduction rate is over 1. And we know now that we have actually, we went down, and it was a terrible situation that we have went into the second wave. And this is something that was known to the politicians. And there is something where science should, in my opinion, should have been stronger, because here what happened in July, August, our reproduction rate was always above 1. But we had still lower case numbers, but it started to build up. And this is actually the period which is important, that you have, if you have long period over with a reproduction rate that was over 1, this would actually predict that you run into troubles, as we did at the end of October and beginning of November. And I think this is something which is not a justification or an excuse, but it shows that despite we had these measures of surveillance and projections in place, we were actually not able to bring in the evidence that if you have over a long period a reproduction rate that stays over 1 and accumulates not too many cases, that so politically, social politically, people said, oh, we are in a low case situation, but this low case situation produced then this difficult situation we have, with the consequences of cases, hospitalization, as well as afterwards death. Below, you see another issue which we were often asked from the politics, measures. You see here, it is, you don't see it very clearly, but it just shows what actually was forbidden within a short period. And it's all clear to all of you as scientists, of scientists, that you have a multi-causal situation. So when people, then politicians ask, so what is more important, distancing or masks? Then you, of course, you cannot disentangle this if you have the measures brought in the same way, combined with the effectiveness issues that I showed you before. So we went up, but this is, we went up, and I want just to add a few other important characteristics, which are also important for your country and for all the country. In SARS-2, corona, we have one difficulty, and this is the heterogeneity. So here is our country, Switzerland, that the more it's red or dark, the red, it's more, you have a higher proportion infected. And what you see, the whole of Switzerland is not in an, doesn't show an equal distribution. So we have a heterogeneity in space. Then we have a heterogeneity in age. As you know very well, the younger people, they can be infected, but they are not seriously sick. And there is only the problem with those who have comorbidities. So if you have to deal with a disease that has heterogeneity like this, measures on a national level become difficult. Because as you can imagine, if you say it's a big problem now in Switzerland, some people in the central part would say, what are you talking about? We have hardly any cases. It's not our problem. So general measures face a problem. Or if you say, everybody be careful, some people say we are in full swing, we are not getting infected, it doesn't affect us much, so no problem. And so the communication and the tailoring of messages and measures is actually an absolutely crucial thing. And I think this is something where I can say we were failing because we had too many general measures for a whole of a country, but we had less tailored communication. Also, we are in a political situation that would help us. I mean, Switzerland, we have 26 cantons, and health, education is cantonal affairs. So we have a major decentralization, and you have also decentralization in Kenya, Tanzania. Decentralization is an important tool to tailor an intervention, whatever it is, to a given setting. So despite these decentralization possibilities, we have not very well handled in our situation to use decentralization to really go in a very targeted way where things happen. So now with the measures, I would say a few thoughts about the measures, not to saying which is right and wrong, but actually just on what we build on. And the interesting thing in COVID was that the past lies ahead of us. This old picture shows you, even before we had the germ theory, shows you Professor Semmelweis, and who discovered that his students coming from the anatomy lessons, practicals, actually had transmitted much more infection to women giving birth. And the measure at that time, when we didn't know anything about bacteria in the mid-19th century, was that one said hand washing. So you see, the hand washing thing was actually what came up as a first thing in the measures, not only in Switzerland. These were the posters, not from Semmelweis period, but from this spring, where we said, do wash your hands. This is, so we were actually going back to experience from before. But what I would like to do, think about more about choosing measures and what were considerations. You see, the basic issue in measures is the question that they are feasible, that you can bring it into a population, acceptable, and it's also proportional, that it is actually relative to other risks and measures. Is it really is it justified to have one strict measure compared to the living situation, the social tissue, the economic tissue? And of course, it is important that there are joint efforts and that there are actually cross-border issues. I mean, you had this in very clearly also in Kenya. I mean, we cannot just sit in a country, close up the country. New Zealand did it. New Zealand, sitting on islands, was actually just closing everything, and then they got actually through very well. we in a country like Switzerland sit in the middle of Europe. We have to see what France, Germany, Austria, and Italy do. Then came the question of the lockdown. The first lockdowns were done because we were overwhelmed and had to stop once to get a little bit quiet and to reflect. And we also know that lockdowns, severe lockdowns, are okay to reflect, but then to open again. But if we repeat, then actually it's socially and economically fatal. If you go up and down into lockdowns and then you shut down economy, you shut down social life to a large extent, and then you come up again. And this is very important for the period right now, and for the festive period. People think of the so-called circuit breakers. Circuit breakers are just short, hard lockdowns of 2 to 3 weeks or 4 weeks. And there the problem is that if you do a circuit breaker now before Christmas and then you open everything again, you can still have the risk that you get into a new wave. This is the so-called yo-yo effect that many people know from diets. You actually do a diet, you lose weight, and if you don't do anything afterwards with your food behavior, you are actually back to your old weight very soon again. Of course, we have the outlooks for the vaccination, but if these major efforts are being completed, it still takes time, even if now, like UK announced that they would start vaccinating this week or next week. Takes time. Then the last issue, which you as scientists are interested, is of course the herd immunity. And some of the countries chose a strategy just to say, let's have the transmission going on. People get infected, they're afterwards immune, and things are fine. The problem here in COVID are twofold. One, that the immunity to corona is not an immunity to measles, where you are once infected, once vaccinated, and you are safe for life. We know that the immunity to SARS CoV2 is shorter lived, maybe half a year, and not everybody has, after exposure, a very good immune response. And we have the best immune response when you have been ill, and better even if you have been severely ill. And actually then you get also a good amount of neutralizing antibodies. And then you have the other point, if you have solved the immunity side, you must solve that, that you must protect as a society. You have the duty also to protect risk groups, not the ones who are in old people's home, but those who are actually risk groups that are having comorbidities, but are still actually in our social and economic life. So these are some of the issues in general about measures. What we then did actually, and that's something that's a learning from previous situations in disease control, is that we actually, of course, went, this is, you can say, the Swiss cheese model. Here is our virus. We have the different measures bringing together. We know that each measure has some holes in it, but if you bring measures together like distancing, washing hands, wearing masks, and early testing of symptomatic people, then you can actually protect your population. So with this picture, you should go back to my initial picture on the effectiveness, and then you realize that each of this decay of efficacy of each of the measures follows this law. And actually it's clear that you are a bit better off if you actually have a multi-layered situation. But still the question how you prevent, and that's important, not just that you don't get the transmission through, but that you are detecting very early transmission occurring. And so the backbone of the Swiss approach, but also of some of our neighbors, but less, was actually a learning that we had from working with neglected emerging and re-emerging diseases, that we actually have surveillance response. Some of you remember that in WHO, when we were actually having the scientific advisory group to Tedros on malaria elimination, which I had the privilege and pleasure to chair. I mean, one of the key messages was that we actually have to do surveillance response. That means that you actually not collect data in monitoring and evaluation mode, but you actually do surveillance and you collect data, minimal essential data in space and time in order to find out where transmission occurs, and then you can give a tailored intervention. We have actually had a technical addition which helped a lot. This is the so-called Swiss COVID app. For after the testing, you do the tracing, and those who are infected are isolated, and the main contacts are in quarantine. This TTIQ, this tick, you can do traditionally, but if you have an app, this helps a lot. This app, and that's very interesting on this technology. I mean, initially people said we should just take an app from Singapore or from South Korea, but this will not work in our country because of the Data Protection Act, where we should actually not create a central database. And therefore the Swiss COVID app is totally free of having a central database. The internet protocol on your computer is destroyed after 14 days. So it's really something that is just a help to be alerted when you have the contact with a positive person, but it is not a control issue, as you could see you had in South Korea, Singapore, but also in Israel and so on. So there we lost time to develop it because we had to follow our laws. But what we remain with is really surveillance response. Detect early, see the picture below where a fire starts, so that you can go there and act. And this is possible if you have the decentralization. You do this in the cantons, in the districts in your situation, and you actually have a public health response package tailored to the transmission setting. If you have to have if transmission starts in a party, a parlor, if transmission starts in a choir of a church, if transmission is in an old people home, your action is different, totally different. And so this surveillance response is a key issue, because as long as you can no longer do the tracing and go early, then you run into a wave. And that's what happened now with the second wave, that our contract tracing system was weak, processes were long, and therefore we run into the wave that you know very well, as many other countries. But we have actually with this, and compared to, say, for instance, countries with very hard lockdowns where you could only leave your house for 1 hour, for 1 kilometer situation, this did not bring a better control of the pandemic, but it had a huge effect on the social tissue of the people. The key issue in surveillance response in this approach is communication. It's the tailored communication, and particularly because of what I said with this heterogeneity. You can imagine, and some of you remember, when we had Ebola in 2014, Ebola was much easier to communicate, because from the baby to the grandfather, everybody who was infected had a risk of 50 to even 60% to die. This is a much easier issue to get the community understand the severity and the community to engage in measures. In SARS, with the heterogeneity, we don't have it. So therefore, communication is key. And it comes back to this issue that I've told you before. It is really, if we want to be effective, the question of adequacy, appropriateness, and acceptance is very important. And it is what we learned. Even if you have very nice TTIQ processes of contact tracing with nice technology. It's the processes that count, that we are actually in time, not only just transmitting by email, but also doing the analyze and act quickly. Otherwise, surveillance response does not work. And then surveillance response is like this picture. So we must, through processes, through sharing and well definition of roles and responsibilities in a given ethical and legal framework, we must accelerate these processes. We must not have another new technology. That's how we can make surveillance response work. There's something which comes up in all the countries now, is really, and this is just an introductory slide to show what is basically necessary, is really to look. We have in Switzerland, we did a stress study, concerned about people long time in quarantine, having lockdowns, having homeschooling and home office together, particularly in poor settings where 6 people are in 2 bedroom apartments and have only 2 computers. That is actually the issue where stress comes up, and indeed about during lockdown and afterwards 50 to 40% had stress, and it's only 26%, 30% after lockdown that said, no, I'm fine, I'm in top shape. It's very interesting that those who didn't have stress during these times, they all said, I have more relaxations, I have less obligations, and I can actually have less to do also for the schooling, so I'm fine. But more important for society is actually what those mention about stress. I mean, the burden through the workplace changes, to childcare changes, for being alone, for and the worrying about the future, the job, worrying about that you are actually don't have so much freedom anymore. That was very significant, and this study is now being brought, is continued, because this is really the issue where science must contribute a lot on long-term effects, the mental health, as well as then the societal tissue, to what extent actually the societal tissue is actually affected. So I think this is something which, when we talk about science and such a pandemic, the lesson from this small slide here is not just to concentrate on epidemiology and infection control, but also look at not just to do social science, but really do at the effects on well-being, on the social tissue, because it's the social tissue that carries the economic tissue and not the other way around. And I think this is a key area where science still must contribute a lot. And I mean, talking to ILRI, you have actually there the issue that you have always populations that are in one health situation where one must optimally balance really the well-being of the society that is actually largely carried in the pastoralist groups by the well-being also of the animals and the productivity of the animals. So this is an outlook where science still has a lot to do. Even if we have a vaccine, these longer-term effects of this 1 year of a relatively dramatic situation that has touched the world has to be looked at, because that will certainly determine on how we are actually interacting together, not just traveling, but actually how meaningful are some of the relations, and how meaningful or not meaningful are just to work in distance with Zooms and so on. Here, I mean, the outlook for vaccination is now good, and you read also the journals, and I think just wanted to have summarized on one slide that this is all fine. And but we know that we still have, I mentioned it before on herd immunity, that we have the natural immunity, which is not as fantastic as in a case like measles. The positive thing is that we have nowadays, thanks to the work that we did in Ebola, thanks to the work that we did, for instance, in malaria, we have new ways of doing clinical studies in rolling procedure, overlapping phases. This is actually what we have installed quite a lot through the work in particularly Africa, where we have actually learned how we can ethically correct, develop tools quicker than standard procedures. We have all these candidates, that's all very nice. We should not be a bit careful about the intermediate results because they were only taken after a shorter period, and we really need to see that full phase 3 results are there, because that determines registration, but also post-registration conditionalities. Also, these preliminary results that are looking very well, we have to see there is immunity induced against infection and or disease, or and very important, how long does this go? The good thing again is that we have this iterative process with regulatory agencies to go on and accelerate registration. But on the other hand, each country will have a huge challenge where also science can help, is really to have the whole supply chain. The supply chain management of such a major operation is not the easiest thing in the world. How do you set priorities for risk groups, and in this case, health staff and their families? And how is the communication again? So this is a slide to show that we are on good track, but we have to think about and that we have really to maintain not just to maintain the scientific standards, but also the ethical standards, because that determines acceptance in the communities. So we have something to come. We could actually discuss a lot about these many discussions, which are really the ways of transmission and the roles of aerosols. We have the issue of the children here as a key sentence, is that children are not the drivers of the epidemic. They can be infected, they can transmit, but they are not the drivers. You have all the discussion on what does actually the PCR test do and not do, and also which rapid diagnostics tests are now being used, even using saliva, no longer the difficult nose, throat swabs that you have to go through. Then the famous discussion on masks, where the difference is very often not made between masks as a barrier versus mask wearing behavior. Most of the risk with masks is how you wear it and how you keep it, clean it, than it's the mask as such, and the immune and the vaccines we discussed. These may be questions that will come up afterwards. But what we have learned in academics and also with the discussion with the politician is actually what I want to come back. Is here the title. We must be humble. We must say that we are scientists. We show what we know and what we don't know, but we must also be pragmatic. And this goes back to this scientist here you saw at the beginning, who is looking and studying. And here, when I see such a scientist and coming out of this crisis, I would say, remember, my dear friends, always the sentence that Sir Bradford Hill made in the time when Sir Bradford Hill was discovering the relationship between smoking and lung cancer. Initially, people said, you need more studies, you need more studies, you need more studies before you can say this is real something that is connected. And many of you have written in your thesis the sentence, this problem warrants more research. When I saw this with a student, I said, you can write this, and I agree, but if you don't know what the more research is, if you are not able to formulate the research question, you better should not write this sentence. So what does this mean for public health and for the link with the politicians? Is actually what Bradford Hill said in this nice long sentence, but it basically says the science does not know all at once. But this does not mean that we are not doing anything in public health. Even if you don't know all and you have to do more studies, you know enough to already do something. And I think this is one of the key issues in the dialogue between the scientists and the politicians. It's always to say what you know and what you don't know, but also what you know and what you don't know already can be done for the benefit of the population, for benefit of a country in order to move. And this is not just a scientific issue, that's also an ethical issue. So I like very much this sentence because this has guided me through 4 decades of research throughout. And I'm very happy that I had the privilege, particularly also through collaboration, and particularly through collaboration and partnership with Africa, to learn these issues on how one actually generates scientific evidence and one can translate it into public health action. And you have certainly now seen that the road to success has no shortcuts. This driver saw this as well. And I would say what the thing is, please don't give up. Let's be committed. We are sitting in one boat. As our colleague says, don't give up. And I thank you very, very much.
Thank you very much, Marcel, for this beautiful and excellent talk. There's a lot of take-home message from the talk, going really from the deep science into the policy, and also the reflection of the public health career applied for this particular pandemic at the moment. So a very rich talk, and I look at the time. Thank you very much for you, and I feel certain that you are, I hope that you are okay, because I feel a little bit tense in the voice. But you talk with people in Nairobi, but also our colleagues in different countries, including Ethiopia, Vietnam, but even our colleague is still sitting in Switzerland for that. So time is almost up, but during you talk, our colleague put a lot of questions, and the question has been kind of answered with the long of the talk. So some of these things was clarified, but here I would like just to take 1 or 2 questions from the group. And our colleague Eric Favre asked you, I think that is quite 2 interesting questions, and I read 2, and you can give some element of answer if you like. Marcel, my question is about the role of science and policy making. There has been a lot of confusion and disagreement in the science community on how to manage COVID-19. How should scientists help prepare politicians to respond? So that is the first one. But I link also to the second question. Maybe it's dear to you because of Switzerland. The question is about shutting down the economy. Europe is about to have a big fight over whether to open ski resorts in Switzerland or other country versus allowing that important sector of the economy to continue working. So in Kenya, for example, there are arguments over opening bars and churches. It is making people, mad, and politicians also nervous. So how can science be convincing on this? Thank you, Marcel.
Thank you very much, everybody. Thank you very much, Hung. I mean, I still have the time, and I've seen these questions also in the chat. I was reading that one. Now, to this first question, the Great Barrington Declaration and so on, I think the point is that the scientists should, as I tried to say at the beginning, always make scientific relevant statements based on the evidence they put together. And I think this is the key issue. As soon as you're making, with a declaration, basically a prescription, you run into a discussion that is not helpful. Because in a crisis situation, it is important to work together and not to say, I believe this, I think this. And I think this is something where away from COVID, in my work in the academies, it's my biggest problem to, in also other topic like gene technology, in issues like biodiversity, climate, energy. is really to find this interface between what do we know as scientists and what actually are options to act, but not prescriptions to act. And I think this is that is the first part of the question. I think that we remain there. So if a Great Barrington Declaration is written in a way where you take all the evidence together and you scrutinize this evidence, be it meta-analysis and other procedures on how we do comparative analysis of what we know and we don't know, then this is fine. All these issues become difficult when scientists become leaders of a group of beliefs, because then we are back to more touchy religious issues. And you know, mankind has not profited a lot from religious wars over 1,000 years and more. So this is the point. Now, the skiing resort issue is a very good discussion. It's not because of skiing and Switzerland, it's because a typical example of where one must reconcile the issue. You know, skiing as such is not a problem. You never get infected while skiing. The problem is where actually when you are going in your cable cars, or when you are going in the evening when it's cold into a small hut in the mountains and so on, that's where your transmission can occur. So the scientist must only state, that's the scientific statement. And it is to say what matters is distance, what matters is hygiene, what matters is contact. If we need to go out of this situation that we are now, we need to bring case numbers down. We should see how we can avoid these multiple contacts, also contacts across the different bubbles where people interact. That's why we have restrictions that you can only meet 10 people out of 2 bubbles, maybe 2 families and so on. And I think this is something which is there. The scientists should not say, let this skiing resort in the eastern part open and in the central part not, but actually really only say, this is what we know as scientists, what favors transmission. So for the inside rooms, it's also the aerosols, the non-aerated places of bars and discos and so on. And actually, this is what we state, but we don't say, close it now. That is actually after the social political discussion where also the economic considerations come in. And Switzerland has now a policy, for instance, that we want to keep certain social life. We are not like other neighboring countries where they say we make a hard lockdown. We want to keep some economy and therefore also social life going. And we keep the schools open in order to allow this. But in these situations, one must really respect these basic measures. The problem is that everybody understands that and is basically happy. But once they are in the situation and once the restaurants are open, people are getting less careful. This doesn't mean they don't respect. But as you could see from my the third slide on effectiveness, if you are only doing things half, 2/3, it has already a huge impact on effectiveness. And this is actually the biggest problem. That's why my point also communication and not propaganda, communication in order to keep compliance and adherence high. And this is, that's the key thing. Today at 2 o'clock, our Federal Council will actually decide how they want to handle ski resorts and Christmas. And we were actually advising exactly in this way, saying you can basically always find a concept that works, but it is afterwards the big issue, and that's also a scientific issue, communication science, how you can maintain high degrees of adherence and compliance.
Very good.
It's just another point which comes in is the rapid tests. Briefly, I mean, the rapid test question. Of course, these rapid tests, and particularly the ones now on with saliva, if well validated, have an important point because they can, it's not that they replace all the tests, but it can be used, for instance, if somebody wants to travel or wants to visit also people in an old people's home. You can do a rapid test because we know they have a very good specificity, have a lower sensitivity, but if you are positive in this rapid test, you are infectious. So you can bring this into your control strategy in a very effective way. And even with the vaccine, we are not then free and can forget about tests. So if you see these rapid tests now coming, plus the vaccine coming, we will have some more tools for an integrated control. Over.
Okay, thank you very much, Marcel. And actually, you are reading also the message, and actually very nice that you brought this rapid test. Time is not up, but Marcel, maybe I take the liberty because I have the microphone now to ask a short question, and I want you to tell us only in 1 minute maybe. You always talked about mutual learning for change among us in research partnership. And now for this COVID context, you see example of Vietnam, where I come from, and sometimes I'm proud of that. We control COVID quite well with China. So, and that's kind of low, in middle-income countries. And when you look at Europe and North America, the situation is much more, it's a very drastic increase on this thing. So what is the short comment on the mutual learning for change within these two contexts? How we can learn from you, and how some of these, heavily hit by COVID-19 can learn a bit from some countries. They have, they have a better control in the sense that number of cases and number of deaths at the moment, where I refer to Vietnam and China. Thank you.
Thank you very much. I think it is an important discussion, and I think it's actually we looked a lot about the Southeast Asian situation, and here, as I tried to mention briefly with the app, I mean, it would have been an easy thing, and we would have done better if we would have just taken the South Korean and the Chinese app systems. But this actually leads to a situation, Hung, where we are not being capable to introduce that in the population. The biggest hesitation is also, Birgit Habermann asks similar questions. The situation is that people are suspicious to have a central database and to be controlled. Also Israel, we did very well at the beginning, and in Israel, they just had to switch over the contact tracing to the Secret Service system, and they could actually have each smartphone in the whole of Israel and in the occupied territories locked. And this is something which was not accepted. So the learning was that we needed such apps. The learning was also that it could not be transferred immediately, and we had it to detach, in the case of the Swiss COVID app, it from a GPS-based link, so that people could not be linked where they are, and actually it had to be delinked from a central database. And so it was a learning in a situation, but it is also comes acceptance and feasibility in a given social political system, and that's very important. So the same thing is when Birgit in the same context asks about the Ampel system, that the traffic light system. I mean, a traffic light system for a whole of a country is basically not possible with the heterogeneities we have. Because if you would do this, then some parts of the country would say, for us, it's green, it's not red. And if you want to do this by canton or by district, it becomes very complex to have really real-time information, and not creating also systems that a situation that we had in Geneva, we had a lot of cases. As a consequence, people they closed the bars and restaurants and everything. What happens? They went to the neighboring canton, and they had the big parties and so on. And then as a consequence, these cantons run into a much quicker second wave. So having this Ampel system or this traffic light system is a tricky issue. And particularly if you are close together, of course, nobody, if you close the bars in Kenya, in Nairobi, will then run to Mombasa for a party. But I mean, it's a different situation if you are very close. So this adaptation to the local setting is in these situations absolutely important.
Thank you very much. That is very nice comment and input from you. Marcel, time is up, but I would like to say that it was really a big privilege to have you today with our ILRI staff. And thank you very much for your contribution and sharing. And I wish you all the best. And we hope that, we keep this contact going on. And I take this opportunity to thank you very much for the past support to our partnership, ILRI and SUTPH. Thank you very much, Marcel.
Thank you, everybody. Thank you very much. I will send Hung the slides, and he can then distribute it to all. These are open and free for everybody, and without any doubt, I mean, we will continue our partnership. And I still remember the time when I was at ILRI, when it was still ILRAT, and I now see where you are, and I have followed your part. From actually 1976 onwards, when I was working with Hirumi on the cultivation of the bloodstream forms of trypanosomes. That was actually part of my PhD thesis in 1977. So I mean, I'm very much linked to all of you, and I admire the work you do. And we bila shaka. Tunaendelea pamoja. Asanteni sana. Thank you very much, dear friends.
Thank you, Marcel. And I'm very pleased to hear the connection that you've had with ILRI all these years and continue to have. Let me join Ung and all of our colleagues for and thanking you for your participation today. It is one on what we call our roundups, as Ung may have told you. And these are about trying to keep our staff safe, staff and their families, whilst we continue to do our work, business continuity. Your talk today contributed to both. I enjoyed it very much. And so let me thank you again. During that talk, I heard a lot about scientific knowledge, which clearly you have, but also considerable experience. And those two combined, the knowledge and the experience, I got a lot of wisdom out of what you said. So thank you very much, and really appreciated that you've been able to join.